Polycystic ovary syndrome is not a single disease, but rather a constellation of symptoms. Its exact cause or causes are still not fully understood. In a normal menstrual cycle, the brain produces a hormone called GnRH, which travels through the bloodstream to the pituitary gland. In response, the pituitary gland releases two important hormones, FSH, or follicle-stimulating hormone, and LH, or luteinizing hormone. These hormones then travel to the ovaries. Inside the ovaries, they stimulate around 6 to 12 follicles to awaken and begin maturing. As these follicles grow, they produce estrogen, which signals the lining of the uterus to start thickening in preparation for a possible pregnancy. Among those developing follicles, one usually grows slightly faster than the others and becomes the dominant follicle. This dominant follicle moves toward the surface of the ovary, where it prepares to release an egg. Meanwhile, the remaining follicles gradually break down and disappear over the following days. Once the egg is released, the emptied follicle seals itself and transforms into a structure called the corpus luteum. The corpus luteum then begins producing progesterone. This progesterone creates a negative feedback effect on GnRH, helping regulate its release and maintain a normal hormonal rhythm. The released egg then begins its journey toward the uterus. If the egg becomes fertilized, it may implant and remain in the uterus. But if fertilization does not occur, the egg disintegrates within about 24 hours, and the woman eventually experiences a normal menstrual period. One of the major abnormalities in PCOS is the disrupted release of GnRH. Instead of being released in a smooth cyclical pattern, GnRH is released at a much higher pulse frequency, for reasons that are still not completely understood. This rapid pulse frequency shifts the hormonal balance, causing LH levels to rise higher than FSH levels. Because FSH remains relatively low, the follicles do not mature properly and fail to become fully functional. As a result, ovulation often does not occur. When ovulation fails to happen, the follicle never transforms into a corpus luteum. Without a corpus luteum, there is no significant rise in progesterone production. The lack of progesterone then feeds back into the system and contributes to the persistently high GnRH pulse frequency seen in PCOS, creating a self-perpetuating cycle. The follicles that fail to ovulate remain trapped within the ovary as small cysts. These multiple cysts represent previous failed ovulation attempts and are one of the hallmark features of PCOS. At the same time, the elevated LH levels overstimulate the theca cells in the ovaries, causing them to produce excess amounts of male sex hormones, known as androgens, including testosterone. These elevated androgen levels contribute to many of the classic symptoms of PCOS, including hirsutism, acne, menstrual irregularities caused by hormonal imbalance, and infertility due to the absence of ovulation. Insulin also plays a major role in PCOS. This hormone is produced and released by the pancreas. In addition to regulating blood sugar, insulin can also act on the theca cells of the ovaries and stimulate them to produce even more androgens. As androgen levels rise, the body's sensitivity to insulin decreases, leading to a condition known as insulin resistance. When insulin resistance develops, the pancreas responds by releasing even more insulin into the bloodstream, which in turn drives even greater androgen production. The entire process becomes a vicious cycle. Over time, this cycle can increase the risk of developing prediabetes and eventually type 2 diabetes. The foundation of PCOS treatment begins with lifestyle changes. Maintaining a healthy diet, exercising regularly, losing excess weight, getting adequate sleep, and avoiding smoking can all significantly improve symptoms and overall health. There are also several medical treatments available for polycystic ovary syndrome. Birth control pills can help regulate menstrual cycles and lower testosterone levels. A medication called metformin may help reduce insulin levels and improve the body's sensitivity to insulin. Another medication, spironolactone, is often used to help manage excess hair growth caused by elevated androgen levels. For women trying to conceive, medications that support ovulation and healthy pregnancy may be prescribed by a specialist under careful medical supervision. Thank you for watching.